A very good morning to one and all press joined us for this webinar series. It gives me immense pleasure to welcome you all for the webinar on commemorating the World Breastfeeding Week 2024, all about the breast milk. And today we have Dr. Leena Matthew to be presenting us on the topic Nourishing the Next Generation, Nutritional Essentials for Pregnant Mothers. Over to you, ma'am.
Thank you, Dr. Azuma. Myself, Dr. Lina Matthew. As we all know that we are entering into the breastfeeding week this month. So here today I am all with you all for giving some insights on the nourishment for the next generation. That is, what are the nutritional essentials or requirements for the pregnant mothers as well as lactating mothers. So we all know that the phase of pregnancy, that is, it is very essential to give any kind of care and need, that is both physiologically as well as mentally, psychologically, all the care and need is required during this phase. And there is also there are many kinds of changes, or the body is undergoing different kinds of changes during this phase. Next slide. So the main changes, basically the physiological changes will be, one is there is an increase in blood volume as well as the composition. That is, when we talk about the blood volume, there is a greater increase in the plasma volume, as well as there is an increase in the need of RBCs, that is the red blood cell counts, hemoglobin concentration, as well as this when there is a greater need of all this red blood cells, all the blood volume, this will actually lead to a deficiency, or a deficiency called as anemia, which was mainly seen in the pregnancy. And there are also other requirements, that is the requirement of iron, not only for the hemoglobin synthesis, but also for the growth of fetus, as well as for production of certain kinds of enzymes. And the other change is the cardiovascular and pulmonary function. So there will be actually an increase in the stock volume as well as the maternal heart rate during the phase of pregnancy. And when you talk about the gastrointestinal functions, we all know that during the phase of pregnancy, the main symptoms which is seen is the sense of nausea or vomiting. That is mainly known as hyperemesis gravidarum. So this is actually known as an adaptive mechanism. So adaptive mechanism, as in the sense, when the pregnant mothers is consuming some kind of food items, that is some kind of teratogenic agent, they'll be actually staying away from those agents when they feel some kind of sensations or some kind of disturbances in the GI tract. And this the nausea or vomiting sensation can also be caused due to the decreased intestinal paralysis. And this is mainly seen during the first trimester or the first 20 weeks, and usually resolves by the first 20 weeks. And there are other changes like the psychological changes, which a pregnant woman or a lady who is going through the phase of pregnancy feels. That is, there will be some kind of psychological disturbances, that is some kind like mood changes or the mood swings, depression, anxiety, and whatever kind of feelings, that is, they'll be feeling so sad and depressed towards the excitement, or some kind of reaction towards the excitement phase. That is one thing. And the other is the renal function. So when there is some kind of changes going on in the body, so the kidneys or the pelvis, they actually keep dilating. And this will actually, push the uterus, and some kind of, the frequent urination is felt during the phase of pregnancy. That is due to the downward pressure of the uterus. And when we talk about the uterine environment, so the size of the uterus actually increases almost 5 times than the normal. And at the term, and this will actually displace all the contents of the abdomen to the sides. Next. So when we talk about the maternal weight gain, So during the pregnancy, the baby's weight is actually influenced due to the pregnancy weight gain. So some kind of conditions like we have seen that there are some conditions like low birth weight babies, which are actually at the risk of due to some kind of illness or due to the malnutrition, which is mainly caused by the mother. And woman who is actually healthy or there is a proper BMI maintained during the pregnancy will actually give birth to a healthy baby. And it also says that during the first trimester, the expected weight gain is actually 0.5 to 1.8 kg. And during the second and third trimester, that is together, that nearly 10 to 12.5 kg. And there are also some conditions or cases where actually the mother's weight keeps increasing. That is, there will be a rapid weight gain during the trimester. So when there is something like the mother is going into a state of obesity or the body weight keeps drastically increasing, the one thing they need to follow is they can cut down some kind of calories. That is mainly the 0-calorie food items or some kind of junk food items or some sugary food items. What to say, cakes, pastries, all this, when they cut down, there will be a reduction in calories. And also using of some kind of low-fat dairy products. So this low-fat dairy products will actually reduce the fat intake and also use of lean meats, poultry, fish, all those things. And changing the cooking method. That is using of bake, boil, grill methods or stir frying consuming instead of consuming any kind of fried food items or using of boiling methods. So these are one of the methods they can use when there is an increase in their weight gain. And also it is said that some kind of physical activity is advised during this phase, that is only with the help of a clinician or a person who is actually expert. So only follow those methods. And there is another no-no to this phase, that is do not diet. When there is an increase in body weight, generally people feel that cutting down of a tremendous calories or dieting will actually lead to reduce in the body weight. So during the phase of pregnancy, it is strictly prohibited to diet. Next slide. So these are the few requirements which generally required during the pregnancy. That is, the health of newborn baby depends mainly on the nutritional status of mother during and prior to the conception. That is, whatever kind of lifestyle or food habits the mother is following during the pregnancy or before the conception, that will actually contribute to the newborn baby's healthy lifestyle. So a well-nourished woman suffers fewer complications during pregnancy and has less chance of premature birth. So there is some kind of birth defects or there is premature births or some kind of illnesses which will be causing to the baby, that is actually related to the mother's malnourishment. And maternal diet during pregnancy has direct influence on the fetal growth, size, and health of newborn. So adequate consumption of food items is actually advised during the pregnancy. And inadequate diet during pregnancy will actually lead to some kind of hemorrhage during the pregnancy, delivery, or low birth weight babies, or due to prolonged labor. So what are the actual requirements or the nutrient requirements during pregnancy for a mother or a mother, or that is a new mother? So the pregnant women need more energy to supply the increased fuel demand by the fetus. So we all have heard that during the phase of pregnancy, you are not only giving or nurturing your own self, but you are nurturing the new life inside you. So here also it says that the energy demand is actually increased during the phase of pregnancy. And it is mainly increased because the additional energy is required mainly for the growth of fetus or the activity of fetus or the growth of placenta as well as the maternal tissue. And increase in maternal body size is also one reason. And there is also a rise in the BMR, that is the basal metabolic rate, and the energy requirement. So basically it says that a 350 kilocalorie or more of energy is required during the second and third trimesters. And other complex carbohydrates and proteins are also preferred this source of energy, as well as some kind of fats are also contribute to this source of energy. So when we talk about the fat, so pregnant woman consumes actually 33% of the total calories from the fat. So when you talk about fat, it is not the junk fat or the bad fat or the cholesterol. It should be actually derived from the good sources of fat. So fat consumed in the food is used as an energy source for fetal growth and development. So fat serves as a source of fat-soluble vitamin. That is all the fat-soluble vitamins, as well as the essential fatty acids like linoleic acid, linolenic acid, and docosahexaenoic acid and arachidonic acids. So maternal intake of omega-3 fatty acid. So this is actually essential fatty acid, which is actually contributing to the growth and development of the baby. So there are different sources of omega-3 fatty acids, which will actually give a good amount of fat to the mother as well as to the baby. And also it suggests that ICMR experts have given a quantity, that is 30 gram of visible fat during the day of pregnancy. So that is actually the required amount of fat which should be consumed by a pregnant woman. So next, when we are talking about the vitamins, that is the essential vitamin during the phase of pregnancy, that is the folate or folic acid. So what is the dietary requirements? That is for the pregnant woman, it is 600 micrograms, and for the lactation, it is 500 micrograms. So this folate or folic acid is actually responsible for cell division, organ formation on first trimester. So when there is any kind of deficiency of this supplement or this vitamin, that will actually lead to some kind of birth defects. And there are different sources of vitamin B, this folate, that is green leafy vegetables, whole grains, citrus fruit, nuts, seeds, dry beets, peas, lentils. All these are actually contributing to the requirements. And it also says that during the first trimester or before that, the supplementation is actually given when there is inadequate consumption of this vitamin. There is other vitamins like vitamin B12 that is actually helping in the brain and formation of system development in the fetus, as well as vitamin A, which will actually protect the fetus from the immune system problems and blindness, infections, and death. So other vitamins like vitamin D, vitamin B6, and vitamin C are also advised during the pregnancy with a required amount. And it also says that there is an increase in iron absorption, and also it helps in fetal growth. So any kind of deficiency of the vitamin C will actually lead to some kind of preterm delivery. And the vitamin K, which is required for the normal coagulation of blood and prevents newborn infants from the hemorrhage. So these are the required vitamins. So next we are talking about the minerals. That is the minerals like calcium, which is will help in during the stage of pregnancy as well as lactation. So it is advised that 1 gram per day is the required amount of calcium which should be consumed from the diet. So calcium intake will help in decreasing the hypertension. That is the hypertension which is induced due to pregnancy or the preeclampsia in mothers, as well as the low birth weight of the babies. And it also helps in maintaining bone strength, proper muscle contraction, and blood clotting. So next, a nutrient is iron. So this iron will actually help for the formation of red blood cell mass, and the iron content in the placenta, building the iron stores in fetal liver compensate blood loss during delivery. So another nutrition is the iodine, which is actually help due to the decrease in BMR. This iodine needs are also enhanced during pregnancy. So the iodine essential to produce more thyroxine. So there is a required amount of iodine which is needed for the in the stage of pregnancy. That is 180 micrograms per day. So the main sources are iodized salt. So the zinc. when we talk about the zinc deficiency will actually lead to fetal mortality or some kind of malformations or reduced intrauterine growth rate. Sodium. So the normal sodium intake is without restriction is advised during pregnancy. And in case of hypertension, that is mainly the preeclampsia, eclampsia, or the pregnancy-induced hypertension, it is actually asked to reduce or restrict the amount of sodium. So next is about the cravings or harmful beliefs, avoidance and aversions. That is, we all know that there are some kind of cravings or aversions which is actually felt during the stage of pregnancy. So this is actually common in pregnancy, and some kind of cravings, that is sweet tooth or some kind of cravings towards certain kind of food, or what to say, aversion kind of some kind of food. Some kind of food items actually will lead to some kind of aversions. That is, even the smell of the food item or even the sight of the food items will actually produce some kind of aversions. And there are another conditions called as pica. That is the pregnant, that is not only seen in the pregnancy, but also generally seen in different kinds of individual. But during the stage of pregnancy, the pica actually increases. So there is an urge to eat non-food items. So we have seen that there are people who even eat chalk, dust, or some kind of dirt. And some people are also fond of trying to taste the detergents. So these all comes under the pica. And when there is some kind of such consumption, that will actually interfere with the nutrient intake. So next is the complications and what are the nutritional implications for those complications. So one is the constipation and hemorrhoids. So this constipation mainly occurs due to the hormonal changes that are associated with the pregnancy. And this is often, worsened by the calcium and iron supplements. So the main solution for the constipation or hemorrhoids is consuming more of liquids, that plenty of liquids. So these liquids can be anything. So the water, soups, or any kind of juices, all this falls under the category of liquids. And generally, the pregnant woman is also asked or advised to have a small leisure walk every day, and to include some kind of food items, that is to include prunes, that is the dry grapes, or some kind of vegetables, fruits, whole grains, which will actually contribute to the fiber intake. And there is another condition which we have already discussed, that is nausea, vomiting, or hyperemesis gravidarum. This is actually seen in the first trimester. So we have seen what are the causes of nausea, vomiting, and there are some kind of guidelines which you need to follow during this time. So it is advised that whatever food items you are taking, you are asked to take it in a small quantity. That is, you can include it as a 3 large meals or 2 small meals. And it is best to avoid any kind of fatty food items, that is the greasy or fried food items. And whenever after a consumption of the food or after your meal intake, you are advised not to lie down immediately. So having a small walk or sitting upright is actually advised. And consuming of liquids if it is difficult to eat solid. So consuming any kind of mashed food items or consuming in the form of soups. So it is said that some kind of the starchy food items will actually help in overcoming this kind of nausea or vomiting. And there is another condition, that is the pregnancy-induced hypertension. So that is the high blood pressure which will occur after the 20 weeks of gestation. So here it is advised that there is mainly a restriction of salt. So if there is any kind of edema or swelling found, it is better to restrict the salt intake or avoiding any kind of salted food items, chips, namkeens, etc. So there will be also gestational diabetes mellitus during the stage of pregnancy. So the cause can be either the family history of diabetes, or the person is obese, or the person is older than 25-year-old, or had prior gestational diabetes mellitus during the last pregnancy. So this usually starts at the week of 20 to 28 weeks. And when there is an uncontrolled diabetes mellitus, this will actually lead to preeclampsia, that is the hypertension, or that will also lead to some kind of difficulty in the delivery. And there will be a fetal low sugar at birth and some kind of birth defects as well. So the edema and leg cracks, which is also a constant sign, which is seen during the pregnancy. This is actually seen during the last trimester of pregnancy due to water retention or because of an increase in overall blood volume. And another problem which the pregnant woman face is the heartburn. So this is common during the last trimester, as well as there are some kind of guidelines which are asked to follow during this, what to say, when a pregnant woman administers the heartburn. So eating of small frequent meals or consuming of avoiding highly seasoned foods or avoiding some kind of fatty foods, etc. are administered, and also asked to walk or sit upright after the meals. Now, what are the food items a person need to avoid during the pregnancy? So there are some food items like raw meat, consumption of raw or uncooked meat, and daily meat. Daily meat are the meats which are actually used for the sandwich, the sliced meat, or consumption of unwashed vegetables. This will actually lead to some kind of infection. So the pregnant women are asked to abstain from consuming any kind of these food items, and consuming fish with mercury, or the fish which is actually exposed to industrial pollutants, or consumption of raw eggs, unpasteurized milk, soft cheese, caffeine, and alcohol consumption. Alcohol actually will lead to some kind of alcohol-induced conditions to the newborn. So this is a plate which shows what are the food items actually a pregnant woman should consume. So the My Pregnant Plate. So here they are giving us idea about the non-starchy food items one should consume, or what are the sources of protein. Mainly the sources of protein like good sources. So the mainly the animal protein, or people who are vegan or vegetarian, they are asked to consume more of vegetables. So, and what to say, nuts, soy, everything is asked to consume in this plate. And other food items like whole grains, legumes, starchy vegetables, and consumption of fruits. So the fruit should be consumed only during the daytime. It should not be consumed during the night time. And also there should be a gap between the fruit consumption as well as the meal consumption. And it also says that food items like coffee and tea. So these food items are not administered along with the meals. So there should be a gap of 1 hour during the 1 hour of gap should be taken before consumption of coffee or tea, because a substance called tannin in that will actually inhibit the absorption of iron from the meal what you have consumed. So next we are going into the lactation, and there are different stages of lactation. That is the mitogenesis, lactogenesis, galactokinesis, galactopoiesis, and involution. So these are the different stages from where the development of mammary glands happen, and where is secretion of milk or synthesis of milk, ejection of milk, and there is post-lactation stage as well. So next we are seeing what are the components in the human milk. So what are the nutrients which is actually present in the milk. So major component is water, and the other sources is energy. So the major energy source is carbohydrate. So the carbohydrate has lactose, which is the dominant carbohydrate, and lipids, that is docosahexaenoic acid is essential for retinal development, and trans fatty acid, which is actually required, or which is taken from the maternal diet, and the cholesterol. And there is also a protein that is a mixture of whey and casein is also present in the milk. And another water soluble as well as fat soluble vitamins, minerals like iron, copper, zinc are abundant in cholesterol. So next, when we are talking about the energy requirements, it says that mostly the calories which we need should be actually taken from the food, or it should be taken from the fat source as well. So extra 500 kilocalories is required during the phase of lactation. And it also says that exercise is also advised with breastfeeding, and all the recommendations of the pregnancy are also, there is more recommendation in the phase of lactation. So energy cause of lactation is determined the breast milk output. That is how much amount of breast milk the baby takes, or what is the energy expenditure. So the carbohydrate. So it also says that it is the main fuel for necessary for the fetal brain function or development. And 175 gram of carbohydrate should be consumed in the food items on a daily basis. And when we talk about the fat, so the adult should consume generally 200 mg of fat per day, and the pregnant and lactating woman should consume at least 30 gram of visible fat. So this fat should be actually from the essential fatty acid, that is omega-3 and omega-6 fatty acid, which is actually used for the brain materials. And what are the food sources of omega-3 and omega-6 fatty acid? So some food items like fatty fish, that is mainly the salmon, mackerel, sardine, tuna, egg, flaxseed or chia seed, walnut, soybean, etc. are the food sources of omega-3 and omega-6 fatty acid. Next, what are the other requirements during the stage of lactation? That is, there is protein requirement. That is, adequate amount of quality protein should be included in the mother's milk. That is, the good source of protein or the plant-based or animal-based protein should be included. During the 6 months of, that is the first 6 months of lactation, 75 grams of protein per day, and during the next 6 months, it should be 68 grams of protein per day should be consumed. And when we talk about the calcium, the additional calcium is required for breast milk secretion. So it says that the 1 gram of calcium, which is actually taken by the mother through the diet. And actually, when the fetus or the infant is taking the breast milk, the calcium will be actually taken up by the infant. So there is a requirement of extra calcium, or extra calcium is required for the mother. And the iron. So 30 mg of iron requirement during lactation in addition to the requirement of mother, and is required to take up the iron secreted in the breast milk. So most of the lactating women who have lactational amenorrhea, that is, there is absence of menstruation during the lactation period. So there will be no loss of iron through the menstrual blood, and this can be saved up for the breastfeeding. So I had already told earlier, that is to avoid the consumption of tea or coffee. That is actually, it will hamper the absorption of iron. And also it is advised that taking of food items which is rich in vitamin C will actually help in the improved iron absorption, or that will promote iron absorption. So now let's see what are the advantages of breastfeeding. So proper quality and quantity of nutrients are delivered to the baby or the infant through the breastfeeding. And the rates of growth better in 3 to 4 months. So there is a proper growth rate happening in the baby during the breastfeeding phase. And there are also some properties of the breast milk, that is anti-infective properties that will actually help or what to say, save the baby from any kind of infectious diseases. And also it helps preventing allergy due to the high IgA, preventing antigen absorption. And this breastfeeding also acts as a contraceptive property by high levels of prolactin inhibin synthesis and ovarian steroids, causing a delay in ovulation as well as next pregnancy. So there are also some kind of psychological advance. That is, there is a development of mother and child relationship during the breastfeeding. And also, when there is some kind of skin-to-skin contact between the mother and baby, the baby actually feels secure, emotionally stable, and the mother feels actually a satisfaction, fulfillment, and joy. So there is also other advantage like protective against necrotizing some kind of bacteria, E. coli, or some kind of infection, that is the otitis media, or some kind of dental caries. And the other advantage is that this method of breastfeeding is actually considered safe and it does not contain any kind of harmful pathogens. And also, it is always at the right temperature. You need not maintain any kind of temperature or alter the temperature. And it is also the convenient and always available or the best possible way of giving any kind of nutrition to the baby. So, what is the difference between breastfeeding and bottle feeding, or what are the pros and cons? So, when we talk about the breastfeeding, it is actually breastfeeding will balance the nutrients. So, there is a what to say, giving of high requirements of nutrients to the baby. And when the baby is bottle fed, not effectively utilize nutrients based on formula. So, this formula feed will actually have some kind of nutrients which is actually prepared earlier. So the digestion. So when we talk about the digestion, breastfeeding will actually help in improving the digestion, and there is a proper absorption when the baby is breastfed. And due to the bottle feeding, the baby will be less tolerant to the formula feeding. And when we talk about the contents, so the contents in the breast milk will keep changing based on the stages of production. But in case of bottle feeding, the contents or the formula will remain the same during every stage of feeding. And here the infant is able to determine the amount. So our how much amount of breast milk it needs, or when it feels hungry, or there is no specific what to say extra given calorie during this phase of breastfeeding. But in case of bottle feeding, the caregiver or the mother or the person decides how much of calorie or how much of amount should be given to the baby. And in case of breastfeeding, there is no preparation of time, or it is not available at any time. And in case of bottle feeding, it says that this bottle needs to be sterilized early and the baby needs to be fed before that. And when we talk about the breastfeeding, it should be mainly free of cost. And the bottle feed is actually expensive, and it is in the form of formulas, or the person will have to purchase these formula feeds every time, and that's why it's expensive. And in case of breastfeeding, there is a proper temperature. And in case of bottle feeding, the temperature must be maintained by the person who is feeding the baby. And the mother is available during the breastfeeding. And in case of bottle feeding, anybody can give the milk to the baby, or anybody can feed the baby. So now when we talk about what are the why is cow's milk not suitable for the infants? So when we feed the baby, or feeding the infant with the cow's milk, it has some kind of adverse effects on iron nutrition in infants as well as young children. So the other one is there is some kind of intestinal blood loss, and the iron will be lost through this blood. And the calcium and casein provided by the babies, the cow's milk is in high amount, which will actually hamper with the absorption of non-heme iron, that is the plant produced iron sources. And infants who are exposed to cow's milk before the first birthday are more likely to be anemic and have diarrhea or vomiting, or experience in some kind of allergic reaction to the milk. So these are the few tips which the breastfeeding mothers should be taken care of. So one is that eating a little and often. That is consumption of 3 large meals, 2 smaller meals. That is the frequent consumption of food items. So there should be a smaller gap between the food items, and at least maintain a gap of 2 hours between supper and bedtime. So there will be proper absorption, and there will be proper digestion happening during this time. And also the breastfeeding mothers are advised to take galactogogous food. So this galactogogous food are the food which will actually help in the production of breast milk. So some food items like green leafy vegetables, some like the soy, nuts, or garlic, onion, and fennel, or some kind of green leafy vegetables like methi, etc. are administered during the phase of lactation. And the lactating mother is also asked to include seasonal fruits and vegetable to meet the vitamin requirement. And also consumption of variety of cereals like jaggery, jowar, oats, whole wheat, and broken wheat is good for the mother. Actually, they'll give a variety of some kind of irons, calcium, etc. for the breast product, milk production. And keep yourself hydrated. That is taking of any kind of liquids. So the liquids can be anything, either in the form of water or in the form of juices, soups, or any semi-solids, some etc. will add on to the hydration. And limiting the food items which is rich in saturated fatty acid as well as white sugar. And also the lactating mother is asked to limit the intake of coffee and tea that will actually hamper with the iron absorption. And also the mother is asked to stay active. That is some kind of physical activity is also essential during this phase of lactation. So by this, I conclude my topic. Thank you, one and all.
Thank you, Dr. Leena, for sharing your insights on the nutritional requirements of pregnant mother and the lactating mother. Thank you, viewers and health seekers, for joining us today. I strongly urge you to join us for tomorrow's session on Beyond Breast Milk, Complementary Feeding Strategies for Optimal Growth by Dr. Jyotsna. Tomorrow at the same time, 11:30 in YouTube Live. Thank you, one and all.